Lubbock COVID-19 News Conference. Today's panelists are the Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, President of Texas Tech Health Sciences Center, Dr. Lori Rice Spearman, and Lubbock Mayor Dan Pope. Let's start with Catherine Wells.
Good morning, everybody. Thank you, Lacey. To just give a brief update on our case numbers here in Lubbock, they continue to be low. Last week, I said that our case numbers were hovering around 100 cases a day, and we are now averaging around 40 cases a day. This number is likely artificially low because many of the testing sites have been closed or had to have reduced hours due to the winter weather. But we are really seeing a decrease in this community, and that is a good sign for Lubbock. Even with this decrease, we can't give up on those key public health messages that I mention every week. We need to continue social distancing, wear that mask when we're out in public, and practice good hygiene. And I really hope that our whole community can work together to continue with all of this as we work on those vaccine numbers. Our clinic or our vaccine numbers continue to remain strong. We have lots of demand, and even in this historically cold and snowy weather, people continue to make their appointments. With some changes and support of additional city departments, we've been able to continue our vaccine efforts this week. Due to the cold weather, we had to close our drive-through option, but we did expand our special accommodation area. The special accommodation area is where those who have difficulty walking can go to an area very close to the front door, and they fill out their paperwork, receive their vaccine, and complete their observation period all in one spot. This really limits the amount of walking through the Civic Center. On Saturday, we also offered golf cart transport in the parking lot. So we were able to bring people who had to park farther away up to the front door. We also have city staff taking wheelchairs out to the parking lot to assist those to come into the clinic. On Saturday, with those bitter cold temperatures, we were able to vaccinate 1,818 individuals. This is only about 72% of our goal. We'd like to reach about 2,500 individuals per clinic. But we are excited that many people were able to come out in the weather. Yesterday, even with the addition of snow and ice, we were able to vaccinate 1,763 individuals, and we will continue all of our clinics this week. Clinic is open today. If you can travel safely, please try to keep your appointment. If you are unable to make your appointment, please call the health department at 806-775-2933 to reschedule, and we will work to schedule you either this Saturday or at a planned clinic for next week. And remember, before booking your appointment, either through the Select a Seat or by calling the health department, please make sure you meet the current eligibility for vaccine. When you make that appointment, you are certifying that you or the person that you are helping meets the qualifications. Don't jump the line. We need to save these vaccine doses for those who qualify. As a reminder, in Texas, we have two eligibility groups. Phase 1A, which are individuals who work in a healthcare setting or are first responders. And then what we're seeing more of is Phase 1B. And those are individuals who are over 65 or those who have an underlying medical condition that could lead to severe illness. When we're talking about underlying medical conditions, we're talking about individuals that have cancer, have chronic kidney disease, diabetes, or obesity. If you have questions about whether or not you qualify, please feel free to call health department staff, and we will be happy to talk to you about those qualifications. And with that, I want to turn everything over to Dr. Cook. Thank you.
Thank you, Catherine. Let me just reiterate, thanks to our good citizens and the job that you're doing to slow down this virus. You've done that by social distancing, by wearing facial covering and washing your hands. Our numbers are looking very, very good. We can't stop. We must continue all of those physical barriers to this virus. Let me also thanks to the volunteers that are coming out to the Civic Center and helping us vaccinate everybody. Thank you, thank you, thank you for helping us do that. We couldn't do it without our volunteer help as well. Because of your efforts, our hospital numbers remain very, very low. We're down below about 6.3% for our number of COVID patients that are hospitalized. That's good. Our hospitals are still full, but that's normal stuff that happens this time of year. If you noticed on the website last night, we still needed 16 beds for all those that were waiting for beds in the emergency room, needed a bed on the hospital floor. So our hospitals remain busy. Let's continue to do our part to slow down this virus and keep our COVID numbers and our COVID patients out of the hospital. Please don't lose your respect for this virus. It's still making people sick. In fact, our death rate is still a little high. It's still lagging quite a bit behind our total number of COVID patients. It will come down, but we must respect this potential virus and its ability to be lethal. Nationwide, the number of children that are becoming infected is going up a little bit. And with that, those individuals that can get sick, children get significantly sick with that MIS-C disease called multi-system inflammatory syndrome in children. We're seeing that number not plateau. In fact, maybe going up a little bit. Please make sure you protect your children. It's a very mild disease in most children. However, some of them do get significantly sick. Let's talk a little bit about the mutations. The mutations continue. As viruses replicate, they can mutate. That's what viruses do. We're now up to about 7 new mutations in the United States. The only way to stop mutations is to stop the spread of the virus. I've not noticed any new mutations here. We have no reason to suspect that those mutations are here. We might suspect it if we have an age group that suddenly peaks in the number of infections in an age group, or our numbers go back up. We're not seeing that, so I don't suspect that it's causing a problem here. Good news is our current vaccines offer protection against those mutations. More good news. There's going to be at least another 200 million doses of vaccine being put into the vaccine distribution cycle around the United States. So another 200 million doses are coming. I read where Moderna is adding 40% more vaccine to each vial that they distribute. So that's an additional 40% there. And just last week, Johnson & Johnson has been approved under the EUA from the FDA. The good news about that vaccine is that it's only 1 dose instead of 2 doses. I know that all of the vaccine manufacturers are also testing younger age groups to help protect them. Right now, they are testing 12 to 17-year-olds. Now, that's not approved. They're just testing that group to see how well they do with how good this vaccine is at protecting against this disease. It's not been approved yet for that age group, but they're doing the studies. After they do the 12 to 17, then they'll go to the next younger block age group to start working on that group. Let me remind you to make sure that you do get your second dose of vaccine if you've received that first dose, to get to that 94 or 95% efficacy rate and protection. You've got to get that second dose. I know the weather has caused some problems for some of you coming back and getting that dose, but we've got plenty of time to get those doses into you so that you're fully vaccinated. Other news from the CDC says that if you have received both doses of the vaccine and it's 2 weeks after that, so if everything was on schedule, so 6 weeks after you've received your first dose, and you get exposed to COVID virus, you do not have to be quarantined. Now that's up to your employer to decide how to interpret that. But the good news is there's a potential that even if you were exposed, you could still go to work if you've had both doses and it's 2 weeks past that second dose. That doesn't mean you don't have to wear a mask. In fact, we must continue to wear a mask, socially distance, wash our hands, all those physical barriers so that we don't pass on this virus to others. What we don't know is that even if you're vaccinated, what we don't know is if you could be exposed and carry it to somebody else. All the more reason to wear that mask. We still have the antibody infusions going on at the former Grace Hospital at 50th and University. So if you turn positive and you're greater than 65 or have one of those high-risk diseases like diabetes or hypertension, chronic kidney disease, obesity, those sorts of things, if you turn positive, please go get infused with this antibody so we can keep you out of the hospital. Let me talk a little bit because we're going to wear masks for quite a while yet. They're not going to go away. I suspect we're going to be wearing masks for probably till the end of the summer. So we've got several months yet. Let me remind you that the mask needs to fit snugly around the entire circumference of your face. So this mask, this is a disposable surgical mask. It has a little metal bendable bar at the top. You can see that there. And so that's the best, but many cloth masks also have that. So it fits tightly over the bridge of your nose and underneath your eyes. It needs to fit tightly around your cheeks and snugly and tightly around the bottom of your chin so that you're actually breathing through the material and not through the sides or the bottom or the top of the material. The CDC has also recommended that because of these mutations, and that some are more infectious than others, that you could wear two masks. One could be a disposable mask underneath and the other cloth mask is on top. Now, if you do wear cloth masks, make sure you wash those in hot water and good soapy detergent because this virus is killed by soapy detergent. I have seen some masks that have the valves on them. Please don't wear those. They might protect you, but they don't protect other people. So it's only being half effective in stopping this virus. If you do wear a KN95 mask, you don't need to double layer. So good mask etiquette going on there. Lastly, I want to talk to you. I've seen some, this isn't virus related. I've seen some social media posts where people are out playing near the lakes, the frozen lakes. This makes us extremely nervous because that ice is not thick enough to support your weight. And if you were to fall through, we probably couldn't get to you in time before you go into a rest, okay? So please keep yourselves and your children away from the playa lakes. That ice is just not thick enough. Stay safe, friends. Wear your masks, socially distance, and wash your hands, and get the vaccine when it's appropriate for you to get the vaccine. Now I want to introduce Dr. Lori Rice-Spearman. She's the president of the Health Sciences Center at Texas Tech. Dr. Rice-Spearman.
Thank you, Dr. Cook and Mayor Pope for having me on today. You know, all of us have experienced some personal loss and professional challenges as we have navigated COVID this last year. And really, I'm here to talk about the good news story that is coming out of COVID as we continue to work together as a community. It has been very heartening to watch the leadership of our city pull together really key individuals across our community to make sure that we're doing an aligned and robust response to COVID, serving our patients, even in times when we as frontline workers were overwhelmed. The city came together and on our behalf asked the community to wear those masks, physically distance, wash your hands, so that we could reduce the burden on our frontline workers. And so we're so grateful to community members for responding to that request and continuing to do so. One of the exciting things that we have done in an unprecedented way is come together, roll up our sleeves and say, okay, how are we going to face this next challenge together? And how can we do it effectively? And I think that we're showing that the city of Lubbock is excelling in this area. One of the things that we're participating in right now that we're very excited to be a part of is the vaccine distribution in response. Our faculty, our staff, and our students have had an opportunity to be at the Civic Center every day, even during these challenging weather conditions. We've had faculty, staff, and students there. Our students have been asking us from day one, what can we do? We want to be a part of the response to the COVID pandemic. And they are showing up out at the Civic Center repeatedly, wanting to be there and be a part of it. And so I continue to encourage our community members to rally around our city of Lubbock. And I like to say that Lubbock's the biggest small town in Texas where we take care of each other. And this is just another example of us doing that. And so it's really my pleasure to participate as the Health Sciences Center in our community response. And at this point, I will turn it over to Mayor Pope and ask him to share some really exciting news that we have.
Thank you, Dr. Rice-Spearman. I appreciate all you've done. I'm going to comment a little bit more on that in a moment. But first, let me share my screen and catch us up on our data for the week. Okay, our hospitalization rate remains very, very good, at a very good spot. In fact, we are starting to give back some of the labor, some of the nursing help in particular that we've enjoyed over the last several months to the state, and we're very thankful for that help. It's worth noting that around the state, all the trauma service areas are below the 15% threshold, with the exception of El Paso and Laredo. El Paso is about 18%. I think Laredo, last time I saw that, was 33%. New case count, you heard Catherine's comments. I'm not going to get focus on the exact numbers much this week because it could be skewed a little bit. The good news, though, is it's definitely going down, and the distribution has not changed. Fewer new cases means less pressure on our hospitals. Pardon me. Hospital beds had a little bit of, yesterday had a little shortage. I think that's weather related. That'll bounce back. It's nothing that to raise any concern. And then finally, doses. This is at this. Remember, this is at the city clinic. Moderna doses administered. I think the best news about this slide, other than the fact that we were open yesterday, is that our citizens are really taking this requirement to get the second dose very seriously. You can see that with the orange portion of these bars. Okay. All right. So just a few other comments this morning. I want to echo what's been said previously, that we realize the impact that the pandemic continues to have on families, individuals, and businesses in our community, and we'll never lose sight of that. Even as things are getting better, we know that some of you are still hurting, and you're in our thoughts and our prayers. We couldn't do this without collaboration, and I think Dr. Rice-Spearman being with us today is a really, really good example of that. From the very beginning last spring through today, the Health Science Center in Lubbock, and I know around West Texas, has been a great partner for cities, as they have been for us. One of my favorite things about visiting the vaccination clinic is seeing the smiles on the faces of the med students who are getting a chance to be on the front line helping out. And we really couldn't do it without our volunteers, and they're a big part of that. Yesterday, we had more snow than we expected during the day. And as I left the vaccination clinic, I was really taken back by the fact that we had about 10 of our Parks and Rec employees there, making certain that sidewalks were clear and that our residents could safely get in and out of the Civic Center to get their vaccination. Later in the day, we cleaned that parking lot and sanded it. Tomorrow, we should have the best weather day we've had in 5. It will be cold. The morning will be slick, but by 10 o'clock when we open the vaccination clinic, it should be easier to travel there. And then Saturday, we will have a full vaccination clinic, and we should have weather that will allow everyone to get there safely. So Catherine, to you and your team and all your partners, thank you so much. We still lead the state. If you look at the top 20 counties and a percentage of those eligible folks that have gotten at least one dose of the vaccine, and we're north of 35% using the state's numbers. There is at least one other county now above 30%, so we have competition with Fort Bend County. I say that a little tongue in cheek, but not really. This is we want to win this race. We continue to work with the state. In fact, I talked to Chief Kidd yesterday. We want more vaccines. We know that those need to be more widely available in our community. They need to be in our pharmacies. They need to be at United. They need to be at Walgreens and CVS, at H-E-B and at Walmart. And we're continuing to advocate for that. That supply is coming. It's not moving here as fast as we want, but patience has never been my strong suit. Finally, citizens, thanks for listening this week. As I pivot off of COVID for just a minute, your efforts to conserve are paying off. We've not had any rolling planned outages on our electric grid today. Thank you. You're listening. Thank you for that. We hope that remains the case. We will continue to communicate with you on a very regular basis. Keep up the good work. Don't let our guard down. Remember that this vaccine is safe and effective, and that it allows us to protect lives and livelihoods. So stay safe, stay warm, and most importantly, let's stay hopeful. Back to you, Lacey.
Thank you, Mayor, and thank you to our panelists. I'll ask everyone to turn on their cameras. Today's media question order is Texas Tech Public Media, KCBD, the Lubbock Avalanche Journal, the Daily Toreador, and El Editor. So let's start with Sarah Self-Walbrick from Texas Tech Public Media.
Good morning, y'all. I only have one question this week. Do we have any idea yet how the weather will affect vaccine distribution for next week?
You want to comment on that?
Yeah, from the state, we actually had a delay in our second dose allotment for this week. We expect to receive that tomorrow, and we do expect to receive kind of next week's allocation, hopefully by Monday. So I don't anticipate it to disrupt our vaccinations locally.
Okay, I do have one quick follow-up, sorry. So going off of that, because so many of our big cities are going through what they're going through, is there any chance that we can get more vaccine doses this next week since we are up and running?
We've asked for it. I can tell you that. That's all we can do. I sent pictures to the governor's office yesterday of the vaccine clinic operating during the snowstorm. They know that we're taking it very seriously.
Okay, good deal. Thank y'all. Stay warm.
Thank you, Sarah. Now we have Karen McKay with KCBD.
Good morning. Sarah mentioned this a little bit. You talked about the weather, and I want to ask also, you've talked about delays in it getting here, but have we lost any vaccines because of the ice storm, or have any gone to waste because of winter storm problems?
Not locally here in Lubbock. We've managed to keep every vaccine safe, and we've given everyone that's been open, it's gone into somebody's arm.
And also, Kathleen, the appointments for the vaccine clinics have not been filling as fast as they did in the beginning. You know, they were booked like within an hour in the beginning. Friday, there were still some available slots at the end of the day. Do you think that people in the 1A and 1B group who want the vaccine are getting it, and we're close to moving on because the others don't want to be on that 35%? And how will you stay with the 1A, 1B group if you choose to, and push for more of them to get vaccinated?
For this week's clinic, I think it was A lot of people held off on making appointments because of the winter storm. I anticipate that when we open vaccine clinics for next week, I anticipate that to fill up again in that 1 or 2 hour time frame that we've been seeing in the past. We are looking at some different ways to outreach to the individuals that are, especially in that 1B group. And we just haven't made decisions on that yet, but we really do want to continue to target them. We can't expand who we're vaccinating until we get that information from the governor or the Department of State Health Services.
Okay, thank you.
Okay.
Thank you, Karen. Now we have Matt Dotre with the Lubbock Avalanche Journal. You're on mute, Matt.
There we go. Okay, sorry. Ms. Wells, you mentioned people are jumping in line. Is that an issue? Are we seeing a problem with kind of people getting the vaccine when they're not supposed to?
I've seen some individuals come to clinic, that aren't eligible. And there's a real balance between how much you want to check on people's eligibility versus making sure that we get vaccine into people's arms. And I'm really just asking the community to make sure that they qualify for that vaccine, that they double check those requirements before they come to the clinic or before they book through Select a Seat.
Okay. And obviously these vaccines kind of have a shelf life. So tell me kind of logistically what you're doing if people are canceling appointments. So are you said vaccines haven't gone to waste. Are you kind of, tell me kind of what happens if a bunch of people are canceling appointments.
What we're very careful about doing is not overdrawing. So we look at the number of appointments and we draw up vaccine into syringes, and that's when the time happens. So as long as the vaccine's in the refrigerator, it's good for 32 days. It's when we start pulling it out of the refrigerator. So on these days where we've seen less people coming to clinic because of the weather, staff have pulled less vaccine out of the fridge. So we haven't had excess vaccine at the end of the day.
Okay, thank you.
Thank you, Matt. Now we have Bao Pham with the Daily Toreador.
Good morning, everyone. So I only have 2 questions. The first one is, since every appointments need to be made to be vaccinated, have you guys ever seen any walk-ins cases? And what do you do with them?
This week, because we've had some openings in our schedule, we've allowed on-site registration, which means that someone that arrives, they can register for a same-day appointment. Yesterday and today are the first days that we've ever been able to do that, and I don't think we'll be able to do that when the weather warms up.
Right. My second question is for Dr. Cook. So you mentioned mutations in your talk. So with extreme cold we are having, will it cause any changes to the virus and the likeliness for one to become infected?
No, Bam. The mutations are really related to the replication, and when the virus replicates, it has to make each one of its particles, and then it puts it back together like a little puzzle. And it's when they put them back together that, like the spike protein, may change just a little bit. So it has to do with replication. It does not have to do with the weather, other than the fact, like our cold weather, I would expect people are kind of staying inside and kind of hopefully not in big groups. So maybe the spread of the virus will slow down even further, which is, I think, good news for us. So mutations occur with replications. So if it's not replicating and we're not spreading it, I don't suspect that mutations are really related to the cold weather.
All right, thank you, and stay warm.
Thank you, Val, you too. And lastly, we have Olga Guerrero with El Editor.
Buenos dias. Hello, everybody. Good to see
Hello.
everyone. Happy and blessed Ash Wednesday today.
Mhm.
First question is, we've been talking about vaccines and all that. I was just wondering, is there a process in place if we were to throw away the vaccine? What is the process of that?
My goal is never to open a bottle unless I have individuals that I can vaccinate. And that's where it starts going to expire, is once we open the bottle. So as long as we keep it in the fridge, we're not going to waste vaccine.
Okay, but if you did need to throw some away, you would literally just throw it away, or would you go through a process and maybe get reimbursed for that vaccine? Or
Yeah, well, we're not paying for the vaccine, but if there was a point, like say something happened to our refrigerators and we couldn't get vaccine moved at an appropriate time, which is not something that's happened here, we would look at vaccinating high-risk populations, whether that means going to an assisted living center or somewhere where we know we can find individuals that qualify prior to it expiring.
Good. Last question. If a person, or what happens when a person misses out on their second dose date and they passed it? Do y'all still give this vaccine to these people? Is it safe? Is it, will it do its work?
Olga, that's a great question. So the goal is to get everybody's second dose of their vaccine within 6 weeks of their first dose. If you're 6 weeks and 2 days, we're still going to give it to you. And so the goal there is, yes, we'll still give it to you.
Thank y'all. Y'all have a good week.
Thank you, Olga. And that concludes our press conference today. Thank you for joining us, and thank you to our panelists and our interpreter for joining us. Remember, for the latest official news from the city of Lubbock, you can always log into Twitter, Instagram, or Facebook to get our latest updates. And we'll see you next week. But in the meantime, please stay off the playa lakes, try to conserve energy, and be safe.
Thank you. Thank you.